Springtime is here. We had showers all weekend to prove it, Mayor.
Now just bring the flowers part, right? It's
Right.
time to break out the shorts, skirts, dresses, and for anybody who has spider or varicose veins, the idea of showing their legs can be downright dreadful.
Yeah, you can get rid of pesky and painful spider veins by summer. Here to explain how, Dr. Jerry Stanley from SCULPT Contemporary Cosmetic Surgery.
Hi,
Good to see you,
Dr.
Doctor.
Stanley.
Guys, how are you doing?
Yeah, good to
Good
see
seeing
you.
you.
Again. So spider veins, are they different than varicose veins, or are they the same thing?
A lot of times they're all related. The spider veins tend to be the real small, reticular, just look like little red and purple hairs that just sit right under the skin. The varicose veins tend to be the little bit bigger, more ropey veins that you'll see on people's legs.
How can you treat them in either case at SCULPT?
Well, the big thing, a lot of people think it's just a purely cosmetic procedure. And for some patients it is, but typically it's venous insufficiency, which is underlying the spider veins and the varicose veins. So some of the deeper veins in the legs, when they stop working well, you'll start leading to the varicose veins and the spider veins. And while we think of it as cosmetic, this is a purely medical procedure. Insurance covers this because they understand that if we can catch it early, we can treat it. And it's a very simple procedure to treat, and it prevents all sorts of long-term problems.
What
So
are
it's
some
not
of those?
just, yeah, it's not just cosmetic though, because you said insurance covers it, right?
This is all covered by insurance if you've got the underlying venous insufficiency. And a lot of times when we treat the insufficiency, the varicose veins, the spider veins will start to go away. And then if they don't, then that becomes cosmetic, and that's where having a cosmetic surgeon, we can really step in and help with little injections and some simple, literally in and out of the office procedures to make everything go away.
So this could be for men as well as women.
Men and women. We're seeing huge numbers of both. The last statistic I read was there's over 30 million people in the U.S. last year diagnosed with venous insufficiency. 6 million sought treatment. So it's underdiagnosed and it's undertreated.
Here's an example of a leg, pre-treatment
see-
and then 3 months post.
Yep, on the left you can see the red ropey varicose veins. On the right, everything looks better. And
That's
this is literally
amazing.
one outpatient treatment. Patient comes in, we put a little numbing medicine. Procedure takes about 45 minutes. They walk out, we let them walk around for 15 minutes, and they drive home.
Now, are they done after that? What's the downtime? Are they down for any period of days at home? Is there a recovery period
No,
at
I
home?
actually want you up. I want you walking. I tell people, do this, then go to work. Get on your feet, walk. What I don't want you doing is just sitting around.
That's amazing. And listen, you said because it can be a serious health issue, and so that would be the motivation for some. If it's strictly cosmetic, that leg looked 20 years younger
Oh, it's a
than
game
the
changer
other.
when you see the difference. That's why a lot of people will say, why do I want to go to a cosmetic surgeon to have my veins treated? Well, we treat a lot of veins, but the difference is our endpoint isn't just treating the vein, it's making the leg look better. So we want to treat the underlying medical problem so that down the road all the cosmetic issues go away.
That's
So
amazing.
how does that procedure at SCULPT, how does it different than from other places that people may go to get treatment for this?
So the technology that we use is radio frequency, so it's a sound wave, okay? And I think we've actually got a clip here where we can actually show. We float a small little catheter into the vein, okay? So literally this is all done through needle holes. There's no knives, there's nothing like that.
No big scars.
No big scars at all. So we literally float this little catheter into the vein. Then we turn on the sound wave device, and the sound wave basically emits this ultra high frequency radio wave, and the vein starts to scar down around the catheter. Then we pull the catheter back and the vein scars down. So you can see on the left, that's the catheter in. On the right, we're turning it on and it's shrinking down. Then as we pull the catheter back on the right, you can see the vein scars down and closes. So the vein that's causing the varicose veins and the spider veins, we go in and treat the root cause of the problems so that all of the cosmetic pieces then go away.
So you do this procedure with every single one of those veins? Is that right?
Typically we just do one.
Just do one vein?
Just do one vein.
And then,
'cause
so
a
how
lot
long
of
does it
times-
take for that procedure?
About 45 minutes.
What were you going to say? If you do one,
So
can it
if you
affect
can
others?
treat one vein, a lot of the varicose veins, you may have 6 or 7 varicose veins that come off of the one root cause vein.
Oh, gotcha, right.
So we'll treat the one big underlying problem, and then all the small little issues on the side will go
You
away.
close the blood flow to that one, all the other branches off of
All
that.
the branches stop.
You said in that picture it said 3 months, but you could see a difference in as little as how
Most
much
people see an
time?
improvement. If you're having swelling or leg pain or issues like that, a lot of people will see at the end of the day their socks have compression, or you can see it sticking into the skin,
Yes.
issues like that, or if you're on your feet. You know, big risk factors are genetic. So if you have a family member with varicose veins, if you've had a baby, or if you work on your feet or you do a lot of heavy lifting, all huge risk factors.
Let's talk about insurance. Is that something that you can help our viewers figure out if their insurance would cover it?
Oh, absolutely. Patients will come and we'll sit down and we'll talk. I'll go through a whole list of symptoms, have you had X, Y, or Z, any swelling, any leg pain, any just fatigue, any throbbing, you just feel like, man, my legs are just really achy at the end of the day. We'll go through all that. We'll do an ultrasound in the office. Once we evaluate the patient, if there's any insufficiency, then we take all the information, we call your insurance company, we jump through all the hoops for you, and then if the insurance company says, absolutely, let's treat this.
Wow. And
We
you're
take
ready.
care of
Obviously,
everything.
varicose veins, they grow as you get older, right? I mean, there's more of them
Exactly.
as you get older. Do you want to catch this earlier?
You want
Will
to
it
catch
prevent
this
some of those?
early, because this is truly an ounce prevention's worth a pound of cure. A lot of times people will think, oh, it's not a medical, it's purely cosmetic. And then when you're in your 50s and 60s, you're dealing with scarring, staining on the skin. Some people develop ulcers in their legs just from bad blood flow. So if we can catch it when people are young, it's a super simple procedure. You're literally, you're in, you're out, you're back on your feet.
And you're back in shorts.
In no
It's going to
time.
be warm enough soon, and you're going to want to wear those shorts and the capris and the skirts, and maybe you haven't brought those things out of the closet in a long time just because you were embarrassed by those veins. We're hearing today there's something you can do about it, and it's simple. SculptOmaha.com is the website. You can also call to make an appointment to see if insurance would cover it for you. Thank you, Dr. Stanley.
Thank you, guys. I appreciate
Great to
it.
see
Yeah,
you.